I've practiced emergency medicine for almost 20 years, and as much as I agree that prevention is key, it doesn't change the fact that there's an ongoing crisis you have to deal with. Certainly in the emergency department, when all the different problems roll in, you can't just stand there and say, well, this should have been prevented. And I appreciate what as first responders and paramedics have to deal with, because we see the looks in their faces when they bring these patients in. It's horrific. Now, I agree to support what my colleague Ms. Kwan said about harm reduction, and I know the data on it, how important it is. Dr. Blackmer, you talked about how burdensome the Respect for Communities Act is. What aspects of it in particular are causing problems in preventing more harm reduction strategies?
I mean, there's a number of aspects, particularly the number of hoops that communities need to jump through and the barriers that are put in place in terms of sort of the letters of support and a number of the other procedures that people need to go through. I think we all recognize, obviously, that input from the community is one aspect of that decision-making process, and it's an important aspect, but it's obviously those sort of letters of support from all these layers and levels are burdensome in a way that outweighs the potential benefit to having input from that community. So that's one example. There are others as well. And I would note, we recognize that the harm reduction is one aspect of a sort of a full approach to this, but it's a very important one. We also know that in communities where these clinics have been established, where there may have been obstacles prior to the establishment. In fact, surveys done afterwards show that in many cases those communities came to see them as being very, very beneficial. So it's it is one. There are a number of aspects to the bill that, while important, provide more obstacles than they need to.